Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I am super excited to have today's guest, Dr. Carolee Estelle. I will give her a moment to tell us a little bit about herself.
Hi, Dr. DeRouen. It's so good to be here, and thank you for this opportunity. So I am a physician in infectious diseases, and inside of infectious diseases, I also sort of subspecialize in healthcare epidemiology. And so I practice at UT Southwestern in Dallas, Texas, and I get to do my healthcare epidemiology, or infection prevention, as many know it, at Parkland Health and Hospital Systems, which is one of the largest safety net health systems in the country. I'm originally from Kansas, and I did my undergrad at Clark Atlanta University, and then I did my medical school at Boston University, and then my sort of postgraduate training was at UT Southwestern, where I'm now junior faculty.
Thank you for that. Fun fact, Carolee is a fellow Terrier. We both went to Boston University School of Medicine, so shout out to them. And with that question, a lot of our listeners are pre-medical students and some medical students. And I just want you to share, thinking way back when you were in medical school, what made you choose the field of internal medicine? Because for those listeners out there who do not know yet, while Carolee is an infectious disease specialist, most doctors who go into ID, as we like to call it, have to start with internal medicine.
Yeah, that's correct. So I did internal medicine training and then a fellowship in infectious diseases. And then I was fortunate enough to get a position as a healthcare epidemiologist, but there is also fellowship training for that as well. So to be honest, I chose internal medicine sort of by elimination. I really encourage people to, as you're thinking about these things, to really take into account what's important to you, what your values are, and what your kind of goals are, and put those together, and then also your interests. So for me, I really enjoyed all of the fields, to be honest, but I also really, really did enjoy surgery and OB-GYN. And the main reason that I took those off of my list was because of the sort of lifestyle that I observed that they had to sort of lead. And while I found them extremely interesting and could see myself doing it and loving it, I wanted a little more flexibility. And I saw that in internal medicine, there are so many subspecialties. I saw that as an opportunity because I tend to have a lot of interests. I tend to like to change what I do. And so internal medicine, I felt provided me the sort of open-endedness of I could still do so many different things with that field, and I could change my career over time. And in reality, that's kind of what happened, because I originally wanted to do hem-onc after internal medicine or primary care. And then I ended up discovering infectious diseases, which is the best specialty in the world that everyone should do, or at least consider.
That's funny because, as we know, living in this global pandemic, infectious disease is quite a hot field right now. I like to call it the Fauci effect. But what made you choose infectious disease as your subspecialty?
Yeah, honestly, it genuinely is one of the best specialties there are. So no matter what organ system that you love and enjoy, infectious diseases is part of it. We touch every organ system in the body. We collaborate with and work with every kind of physician and provider really that exists, because you can get an infection anywhere, and I think I also had interests at the time in sort of global health and things like that. And, infectious diseases are top of across the globe. And also I felt like the infectious diseases physicians that I met were some of the smartest people I'd ever met. And I just wanted to be like them. They were consummate clinicians in terms of their compassion and their excellence with physical exam and interviewing and just being with patients. I always saw patients loving them, because they really spent time with them and connected with their patients. And a lot of them, while they were so incredibly intelligent, had a lot of humility. And I thought the work that they did was amazing. And I didn't find infectious diseases until late in my training, because I didn't actually get to do an ID rotation in med school. It wasn't until the latter half of my internal medicine rotations that I discovered it. But it became my thing.
Wow, that's so interesting and so true. Infectious diseases are everything. It's like the disease processes of the body. The reason that we actually study medicine, we're trying to fix most of these diseases. Yeah. So it's so wonderful that you found something like that. And I also find it very interesting, like your final point where you mentioned you didn't have the exposure in medical school. And that just shows like the variety of kind of listening to this podcast and hearing about different opportunities and fields, because each student has their own different journey, even in the same medical school sometimes, because I actually did have an infectious disease rotation when I was in school. So that's very fascinating to me.
Yeah.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. It's a complicated process, and even students with great grades and MCAT scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
And I think that also speaks to why people should be encouraged to follow their interests, because, and I had never heard of healthcare epidemiology until I was doing infectious diseases. And so I am currently in a career that most people don't know exist until COVID. Now everybody knows what healthcare epidemiologists are and infection prevention. But before COVID, really the only people who knew who we were the people who do it and some of the people in the hospitals. And so it's not something that you're exposed to throughout your training. And yet it's an incredibly interesting field. So healthcare epidemiology and infectious diseases to some degree. But I think what's really beautiful about infection prevention and healthcare epidemiology is we get to do both the direct patient care, right? You get to take care of the individual in front of you and get that one-on-one experience. But we also basically do population health. And from a public health standpoint, our work is focused on the population of the health of our hospitals and our health systems, as opposed to our public health colleagues who are for our whole community. But we get to impact the outcomes for all of the patients for our hospitals and health systems. And so we get to do both individual and sort of more population level impact.
That is phenomenal. And I think everyone can definitely kind of identify how important epidemiology is now, especially during these times. Can you tell the students out there a little more about how one can enter the field of epidemiology and what various aspects of the career may look like for different people?
Oh, yeah. So epidemiology in general is actually a part of every specialty in every field, right? There's an epidemiology of cardiology and gastroenterology and really every disease. It's kind of epidemiology is sort of the way we characterize who gets it, when and how, and what risk factors and things like that. And so it's studying that. And then, but for healthcare epidemiology, we do that regarding essentially sort of diseases that can be transmitted in affected our patients that are in the hospital. So we want to prevent them from getting diseases there. And then outbreaks, when those occur, it's our job to do those outbreak investigations and then coordinate with our health department colleagues for community level initiatives and things like that. So there's actually a lot, in terms of doing healthcare epidemiology, the primary way that most people do that is through internal medicine and then infectious diseases. There are healthcare epidemiologists who are any subspecialty and do this, but they have to generally take a sort of special interest in it. And those are typically going to be other community hospitals that are going to hire somebody that's not an infectious diseases background. To do epidemiology and so again, disease detection, CDC is obviously really, and all public health, those are epidemiologists who are doing that work. And so you can do a master's of public health. And I know that these are med students we're talking to, but people who do a master's of public health, there's also the EIS or the Epidemic Intelligence Service with the CDC, and physicians also can and sometimes do this. And it's an applied epidemiology fellowship, and it's one of the sort of tracks into the CDC, and they call them disease detectives, and they're the ones who go and investigate the outbreaks around the country and in some cases in other countries. And so they get to do it on a community scale. So predominantly through internal medicine and then infectious diseases from the physician track, but can also do an EIS fellowship with the CDC after really any specialty or an MPH or something like that.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
That's fascinating, and it seems like something that we will see a lot more of in the future in terms of the types of career fields that physicians choose to pursue. We talked a lot about how your career kind of happened by happenstance, and you have an open mind and you discovered another field or another way to practice medicine, and now you're basically a modern day Dr. House with your investigations of everything. So I have a question for the students out there who may have not come in to medical school knowing what they would like to pursue, or they may have come in with a certain idea and it may change. What advice do you have for them in terms of discovering what their passion is?
Oh, yes. I say lean into the zigzag or embrace the zigzag. I think everyone should have goals and plans of how they're going to get to those goals. But I think it's okay if your goals change, if your interests change. And how you get there, it's okay for that to change. I remember someone I looked up to when I was in undergrad at Clark Atlanta University said, write your dreams in stone, but your plans in the sand, because your dreams will mostly stay the same, but your plans will change. And I think what that means is, I set out wanting to, I actually originally wanted to be a basic scientist and ultimately became a clinician. But the foundations of the things that I wanted to do and dreamed in the ways that I wanted to help in society, I am still doing those, but in a different way. And so I think just It's okay if you don't know. What's most important, it's okay if you don't know what you want to do. What's most important is that you keep an open mind and you explore. Explore as much as you can so that you can identify what you are interested in and what you're not interested in so that you can eliminate those things and lean into it, lean into your interests, follow the opportunities that they present. And it's okay if you go down a different track because it might just lead you to exactly where you're supposed to be.
I love that. And I actually have nothing else to add. Yay. I absolutely appreciate you joining us today. And for the listeners out there, we're definitely in for a treat and a surprise, because what I didn't mention is that this is part 1 of a 2-part series. So today we discussed about the basics of infectious disease and epidemiology and Dr. Estelle's path to medicine. But she'll be back with us soon in another part to dive more deeply into the COVID pandemic and talk a little bit about where we are in this aspect of what we've been dealing with for the last year and a half.
I look forward to it.
Thank you so much. I'll give you an opportunity to say goodbye.
Well, thank you so much for having me again. And to everybody out there who is an aspiring physician, you can do it, keep it up, and the world is still your oyster.
Thank you so much. This is Erkeda. For all the listeners out there, click that subscribe button, and I'll see you again next week.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.